What is multiple endocrine neoplasia syndrome or MEN syndrome, and some common misconceptions about the type 1 MEN syndrome? These are the two things which I'm going to deal with in this particular Insta lecture session. So let me start with the first one. What is meant by MEN syndrome or multiple endocrine neoplasia syndrome? The name MEN syndrome does not give you the whole picture about the MEN syndrome. Why? Let me explain. The term is multiple. Basically, it means that there is involvement of at least two endocrine organs, because this is a disorder of endocrine organs, as the name implies. Multiple meaning at least two endocrine organs are showing, here comes the catch, proliferative lesion. The lesion need not to be neoplastic, as the name implies all the time, like in multiple endocrine neoplasia syndrome. The lesion can be proliferative, like just hyperplasia. For example, we see parathyroid hyperplasia in MEN1 syndrome. So there is involvement of two endocrine organs in a single patient, and that particular endocrine organ is showing some proliferative lesion. That proliferative lesion could be hyperplasia, could be adenoma, which is a benign tumor, sometimes can be carcinoma, a malignant tumor. For example, medullary carcinoma thyroid, which we get in MEN2A and 2B syndrome. And these proliferative lesions are seen in at least two endocrine organs in a single patient at the same point of time, that is synchronously or with a time gap, metachronously, at a different time. Then this disorder, particular endocrine disorder, is called multiple endocrine neoplasia. Now, the multiple endocrine neoplasia, we all know that there are 4 subtypes, and there are 2 ways we can divide them. One way to divide them is called MEN1. The first one is MEN1 syndrome, then called MEN2A syndrome, then called MEN2B syndrome, then skip the number 3 and go MEN4 syndrome, which is the latest addition. So MEN1, MEN2A, MEN2B, and MEN4 syndrome. Some people divide it in a different way. MEN1 is there, but they call the MEN2A just as MEN2. Then they call MEN2B in the previous version as MEN3, and then they call MEN4. So either you can divide MEN syndrome as MEN1, MEN2A, MEN2B, MEN4 syndrome, or you can call MEN1, MEN2A, which is just as MEN2 as the previous version. MEN2B means MEN3, and MEN4 syndrome. These are the 2 ways you can look at it. Both basically talks about the same thing. MEN2A is equal to MEN2, some people call it, and MEN2B, some people call it MEN3 syndrome. Now I am going to focus right now here on some common misconceptions about the MEN1 syndrome. Now, MEN1 syndrome, we all know that this is basically occurs due to some mutation in the tumor suppressor gene, which is the name is the same, MEN1 gene, located on chromosome 11. And the MEN1 gene produces a protein whose name is MEN1 protein. So take MEN1, MEN-I, and takes proteins in. Add that, so it would become menin. So basically it produces a protein called menin, this MEN1 gene, and this gene basically becomes mutated to cause MEN1 syndrome in the chromosome number 11. Now this MEN1 is a tumor suppressor gene. So when a tumor suppressor gene is suppressed, minus plus occurs. That means there is a higher probability of developing tumor. You can get that idea from there also. Now this MEN1, the common misconception you have seen that people just read there is a common mnemonic there, 3P, that this is nothing but a lesion of pituitary, pancreas and parathyroid and tumors arising from there. This is the common misconception there. So let us see what are the fallacies of this concept. Firstly, it need not be a tumor all the time. Parathyroid hyperplasia causing primary hyperparathyroidism is also a part of manifestation of the MEN1 syndrome. Both parathyroid adenoma and parathyroid hyperplasia is a part of MEN1 syndrome. That is the first one. And second one is this, that MEN1 syndrome, as now it has been clearly proven, is not necessarily confined in these 3 organs. MEN1 syndrome actually go much beyond that, you understand. For example, the neuroendocrine tumors which we see, they are more commonly seen not in pancreas, but we usually see more commonly in the duodenum, like gastrinomas. It can be seen in the respiratory system, bronchial carcinoid. It could be gastrointestinal carcinoid. Even adrenal tumors can be a part of MEN1 syndrome that we've seen. Some skin tumor like skin lipoma, collagenoma could be a part of the MEN1 syndrome. Even brain tumors like meningioma can be a part of MEN1 syndrome. So the point is that it is not at all nowadays confined within those three things, which is the pituitary, pancreas, and parathyroid. Second thing you need to keep in mind that the tumors, now they say it's pituitary, but pituitary only the anterior pituitary is involved in the MEN1 syndrome. We do not get any tumor from the posterior pituitary in the MEN1 syndrome. Posterior pituitary is spared in that sense, you can say. Again, this is a very high concept also. And pituitary, usually the most common tumor which we get is prolactinoma, typically, which is a prolactin secreting neuroendocrine tumor. But the most common manifestation of the MEN1 syndrome is primary hyperparathyroidism. And this is also the initial manifestation in most of the cases. And primary hyperparathyroidism in the MEN1 syndrome can be due to both parathyroid hyperplasia and parathyroid adenoma. So these are the certain key points which you can keep in mind about the MEN1 syndrome. And I already explained what is meant by the MEN1 syndrome. I would continue about the other MEN syndromes in the future insta lecture sessions. Thank you so much.